and welcome to another episode of A Healthier You. My name is Saad Dino, co-owner of Acton Pharmacy, Keys Drug, and West Concord Pharmacy. I would like to welcome everyone back to our show, A Healthier You, where we discuss current health topics and provide information that will guide you to a healthier lifestyle. Today's topic is skincare. Today I will be talking with Dr. Melissa Burnett, a dermatologist from Wellesley. Thank you for being here, Doctor. I appreciate your time and effort to get here and be on our show. I'm so honored. We're going to be educating our viewers on skincare, the importance of keeping our skin healthy and protecting it from the summer sun. Welcome. Can you please tell us a little bit about yourself and your work in dermatology?
Sure. Thank you, Saad. Then thank you for having me.
My pleasure.
So yes, I'm a dermatologist. I'm board certified in dermatology, and I'm also board certified in the subspecialty of pediatric dermatology.
Okay.
And I've been in practice in the greater Boston area for 15 years.
Okay.
Given my certification, I get to see a really broad range of patients from birth to 100 years old, which is a real privilege for me because I get to take care of a lot of families.
That's awesome.
And I practice medical and pediatric dermatology, as well as surgical and cosmetic dermatology.
And where did you go to school?
Wellesley College for undergrad, University of Vermont for medical school.
Awesome, awesome. Thank you. So you mentioned that you're a board certified dermatologist and also subspecialty in pediatric dermatology. What are the main reasons you see children in your office?
Probably the most common, and it differs depending upon their age, but in infancy I see a lot of birthmarks, vascular birthmarks, larger moles or unusual looking moles. As kids get a little bit older, I start to see them more for atopic dermatitis or eczema, and then a little older still, warts, and then as they kind of reach puberty, acne. Dermatologists also take care of not just the skin, but the hair and nails. Okay. And I do see patients of all ages, but especially children with conditions for hair loss. Okay.
The genetic ones, or?
Well, a lot of autoimmune,
okay.
Some genetic skin diseases, of course.
Okay. In terms of skin protection, and that's why we're here today. Many people question what SPF is right for them to apply during the summer, obviously when they're at the beach or the pool or outside. Can you explain what SPF values really mean, number one, and then elaborate on if you have preference of which SPF you should use in the summer and so on and so forth.
Sure. This is such an important topic.
Yes.
And it's a little controversial. I think some of the information that's out there is a bit contradictory, honestly. Okay. The FDA uses the term SPF, which means sun protection factor. Okay. And sun protection factor only measures your protection against UVB radiation. Okay. So when you read about in different magazines or you'll hear about on news shows that an SPF of 30 is adequate to protect your skin, that's because the studies that the FDA did showed that 97% of UVB light was blocked at that SPF in ideal circumstances.
Okay.
So obviously not all circumstances are ideal. And there were studies done a few years ago actually looking at how people truly apply sunscreen. Okay. And in reality, we use about a quarter to a half the amount of sunscreen we're supposed to use.
That's what I've heard. Okay.
Not surprisingly.
Yes.
So when you look at how people actually use sunscreen, we're getting a much smaller SPF from our sunscreen than we think we are. Okay. And so although these are not the exact numbers that they found in this study, but an SPF of 30 was giving about an SPF of 12, an SPF of 50 was giving around an SPF of 22, and as you went higher in the baseline SPF on the bottle, the way you're using your sunscreen, you are actually approaching that level of a true SPF 30. Okay. So by starting with a higher SPF on your bottle and using sunscreen like most people normally do, you are actually improving the rate at which you'll really be getting a true SPF 30, if that makes sense.
Sure.
So I actually recommend to my patients using at least around or close to or above an SPF of 50, because I don't think that SPF of 30 is really adequate for most people using sunscreen the way that we tend to use it.
Okay, so an SPF of 50 is what you recommend?
Yes, yeah, or higher.
Or higher.
Yes.
So does it matter your skin type? If you're light-skinned or dark-skinned or Middle East, Middle East is good, or
So I mentioned that SPF measures protection from UVB. So there are two forms of UV radiation, UVB and UVA. UVB is what causes sunburn. UVA is what causes fine lines and wrinkles, photoaging, brown spots. And right now, there is no way for a consumer to evaluate a sunscreen they're picking up off a shelf and determine how effective their UVA protection is. So right now, they will say broad spectrum, which means it has UVA and UVB protection, but you don't know how good it is.
I see.
And even people like yourself and myself who tend to tan pretty easily, obviously no one wants to sunburn, it's painful. We know that it increases your risk for skin cancer, but also people who tan easily, when you get UVA sun damage, you're still increasing your risk for skin cancer.
I see.
Not to mention photoaging.
Can you describe that? What that is?
Photoaging means that, when you look at, an older person and they may have freckling or brown spots on their arms, you'll notice that the skin loses its elasticity, fine lines and wrinkles. That's what we mean by photoaging.
So does collagen play a role in that?
Oh yes, definitely.
Okay.
So over time, collagen degrades for all of us, unfortunately.
It's part of life.
Yeah, it's part of life. But sun damage over time from UVB and UVA radiation is going to make that worse. And if you asked, are we safer if we tan rather than burn?
Sure.
In some ways, yes, but it doesn't mean we're safe.
Okay.
It doesn't bring our risk to zero. I definitely see patients with what's called Fitzpatrick type 3 skin, which is what we have, which means you tan mostly and sometimes burn. And I see patients with this type of skin that do have both non-melanoma and melanoma skin cancers.
Okay.
So
the sunblock or sun protection that we apply is the most important thing that we could do for ourselves.
I would say sun protection is one of the most important things that you can do for yourself, but I would say that sun screen and sunblock are kind of the final part of that.
Okay, so you just hit on my next question. What is the difference between, you see sunblock and you see sunscreen?
Right.
What are the differences?
So a sunblock is what you'll hear a lot now being called a mineral sunscreen, but it's a sunblock, and this is composed of one of two ingredients, either titanium dioxide or zinc oxide, and they reflect light from the skin.
I see.
Chemical sunscreens actually are chemicals that absorb the UV radiation and convert it into something that is not going to be dangerous to your skin.
Okay. So does it matter if, for this adults and this children? So I mean, in our stores, in other pharmacies or other retailers, they sell many different types of sunscreens, and there's some that are specific for kids, and some are for adults. Is there truly any difference between the two?
Not really.
Okay.
And this is another, kind of issue for the FDA, which is there is, nothing that the FDA mandates as specific for children. There's nothing specifically labeled for sports or waterproof or anything like that. Or sensitive skin, that's another kind of marketing word that you'll see on a lot of different sunscreens. Now, most sunscreens for children will generally contain titanium dioxide or zinc oxide, and usually that alone. Same for sensitive skin individuals. Most products that are marketing themselves for sensitive skin will just contain sunblock. But one of the things that I do with my patients is, and hopefully for your viewers,
Sure.
is you can't educate people on every single sunscreen that's out there. There's too many.
Absolutely.
So I educate them on the ingredients and help them based upon their goals, their belief system, as well as their skin type, their sensitivities, their age, to choose a sunscreen ingredient that is going to be right for them.
Okay, so we hit on the sunblock versus sun and the difference between adult and children. Let's say if one spends too much time in the sun on a given day, you're out and about with a family or a trip and ends up with a sunburn. What is the best next step?
So it's tough because once you know you have a sunburn, it's too late.
I think we've all been there.
We've all been there.
Yes.
We've all been there.
Yeah.
Once you know you're starting to see the pink or you're starting to feel uncomfortable, it's too late. But the thing you can do is immediately cover up your skin.
Okay.
So even sunscreen alone at that point, I don't think is necessarily adequate. I would try to put some clothing on to cover up the skin.
Okay.
And then, of course, when you're dealing with the pain and discomfort of the sunburn itself, anything that can cool the skin and decrease inflammation is really helpful. So, for example, everyone loves aloe. It feels amazing. It's a great way to cool the skin. Topical steroids, even over-the-counter hydrocortisone, can be really helpful after a sunburn to decrease some inflammation. And some people will even use calamine just to kind of calm the skin a bit. I remember when I was a kid, what we did was we put vinegar on our skin.
Vinegar, okay.
I don't know why, but that's what my grandmother taught me. But I'm pretty sure that's not the right thing to do.
So aloe.
Aloe.
Hydrocortisone.
Hydrocortisone.
Which is steroid, but don't apply it to the face.
1% hydrocortisone would be safe to apply to the face for short periods of time.
Okay.
But if you have a sunburn on your face, if it's significant, you probably should talk to your pediatrician or dermatologist to make sure that you're taking care of it correctly.
Okay. So aloe, how about, some people say, can I ice it?
So cooling the skin down is great. Never apply ice directly to the skin because you can then cause frostbite, which actually can be just as bad as a sunburn. So, cooling the skin, though, most definitely can be helpful.
And your ice suggestion is also not just for sunburn, but also for athletic injuries and
Also for athletic injuries.
Always cover an ice pack with something, a towel or whatever, and then apply it to the skin.
I saw a patient last week who gave herself frostbite from treating a hamstring injury.
Oh,
And so it happens.
And they're painful.
They're painful, and they can cause a lot of discoloration and can look really not great for a long time. So,
thank you so much for that, doctor. So now we've unfortunately applied skin and all these skin products to us, and every time we go to the beach we have to go outside and all that good we followed the doctor's orders, but for some reason or another we ended up with some red flags. What are the red flags for skin cancer that our audience or your patients suggest what they should look for at home?
Sure. So the most common type of skin cancer is a basal cell carcinoma.
Okay.
In fact, it's the most common cancer in the world.
Okay.
And basal cell carcinomas tend to present as either a skin color to shiny pink bump. It may bleed easily with minor trauma and bleed and crust. Okay. It's usually in sun-exposed areas. So for example, you might be washing your face and see, oh, there's that spot on my nose that's a little crusty. Then it seems like it gets a little better, but it never really heals. Okay. And my advice is, if you ever have a non-healing lesion, especially if it bleeds easily or crusts for more than a month, you should see your dermatologist. Okay. The next most common skin cancer is squamous cell carcinoma. Squamous cell carcinoma may present as like a red scaly patch that doesn't go away, or a really not subtle, rapidly enlarging nodule, which you really would not ignore. It may be painful, it may not. And then of course melanoma is the skin cancer that we worry about the most, because basal cell rarely metastasizes. Squamous cell can, but it usually doesn't. Melanoma can, and melanoma is all about early detection. Okay. If you treat melanoma early while it's thin, your survival rate is probably going to be 97+% for 5-year survival. As melanomas get deeper and thicker, that statistic goes down. So it's all about early detection, and melanoma can present either as a new lesion or within an existing mole. So take an existing mole, you may notice a change in the size or shape or color of that mole. And for a new spot, it may be a new, probably darker spot than what your other spots look like.
Okay.
So I tell my patients, if you see a new spot that's dark, doesn't look like the coloring that you generally make, if you see it's changing in size or shape or color, come in. But I would like to see it at the earliest spot, a new dark spot. I've found 1 millimeter melanomas on patients just because, in diameter that have been very thin, just because the coloring didn't match the coloring of their other lesions. So color's a really important aspect of melanoma diagnosis. Sometimes melanomas don't follow the rules. Sometimes melanomas will be red or amelanotic melanomas. Sometimes they're white, and that can lead to a delay in diagnosis, which can be challenging.
And what diagnostic tools do you utilize in the office?
So I have something called a dermatoscope, which my husband laughs at the name of. But anyway, it's actually a tool. It's a very, very helpful tool that magnifies and polarizes light. So I'm actually able to, within a melanocytic lesion, to make, like moles, for example, to look at pigment patterns. And there are certain pigment patterns that we've learned are very reassuring and normal. There are certain pigment patterns that clearly are abnormal, showing a very high risk of melanoma. And then there's a lot of in between. And those typically are the types of lesions that I look at and say, it's not completely normal, it's probably not a melanoma, but it looks atypical, we should biopsy it. So.
And you do biopsies in the
office. It's a very simple. It's done with local anesthesia. It's a small little pinch and sting, and we're able to do it usually at the moment of the appointment.
And the results come back in
within a week.
Within a week.
Yeah.
Okay. You hit on moles a little bit. Should all atypical moles be removed? It's
such a great question, and again a bit controversial even in the dermatology world. So I'll just say we rate moles. The pathologist rates the moles based upon what they're seeing for atypical cells and architecture underneath the microscope. They will rate them as either mild, moderate, or severe. In my mind, a severely atypical mole should be treated like a thin melanoma. So I excise those with 5 millimeter margins, and then we monitor. A moderately atypical mole, most people still will remove and get a negative margin on, but it doesn't have to be a large margin, it just needs to be out. There have been some more recent studies in the dermatology literature suggesting that may or may not be helpful, but I have personally seen an excised moderately atypical nevus that came back years later as a melanoma. So I will still be taking moderately atypical moles out. Mildly atypical moles probably don't need any other surgery or any other procedure done. But if I have a patient who's had multiple melanomas or multiple atypical moles, I have a discussion with them about whether or not they want me to completely remove it.
As you get older, you see some brown spots on your hand.
Yes.
What are those?
Usually, those are what used to be called liver spots, right? So usually those are simple lentigo. And a lentigo is basically a large freckle. It's a sunspot.
I see.
And the difference, and patients ask me this all the time, what's the difference? So a freckle or a lentigo has increased pigment, but not increased numbers of melanocytes. Now, lentigos, there is a form of melanoma that actually can develop from lentigo. It's called lentigo maligna. But most lentigo are normal and benign. You may also see something called seborrheic keratoses on patients.
I've heard that term. Yeah.
And those tend to be, they can be lots of different colors. They tend to be elevated and kind of a waxy feel to them. But it's not uncommon. Some of them can be very dark, and people often come in to see me because they're worried about it being a melanoma, and I can very quickly reassure them, which is great.
Okay, cool. Thank you so much. Other summer concerns are, obviously we're outside, so include eczema and bug bites. Can you tell us, more about ways to treat eczema for children and adults?
Sure. That's a whole conversation.
Of course.
But basically, a lot of people don't realize that bathing more frequently, if you're doing it the correct way, can be protective to the skin for eczema or atopic dermatitis. And so the way to do that properly is baths are better than showers. So soaking in a tub for about 10 minutes, using a mild, gentle cleanser that's fragrance-free. And when you get out of the bath or shower, patting the skin dry, and while it's still a bit moist, applying a nice thick cream or ointment. And creams are better than lotions. They will hydrate better, and ointments even still are probably a little bit better than creams. So that can be really helpful for prevention. And when you get a spot that isn't responding to that, use of a topical corticosteroid, or there are also some non-steroidal anti-inflammatory topicals that are available by prescription.
Okay, and then obviously with tick bites. Now, do you deal a lot with tick bites?
Oh yes, definitely. Definitely, and especially around here.
Absolutely.
So the first thing is preventing tick bites is wearing protective clothing. And that's something I'd love to touch back on that we didn't really talk about with sunscreen and sun protection.
Sure.
But protective clothing is really your first line of defense against bug bites and ticks. And certainly DEET-based sprays are very helpful. And my only bit of advice is, especially in young children, putting it on the clothing rather than the skin, I think is really quite beneficial. Kids have a greater body surface area to weight ratio, so anything that is absorbing into the skin will absorb more into a child than an adult. So treating the clothing is always better than treating the skin.
And that's DEET, right?
DEET,
correct.
Yes.
And you recommend those for if somebody's outside, the kids are outside, or anybody, adults. If we're outside, day, night, doesn't matter what time, we should always be applying this just because of the bugs that we're dealing with.
Well, I think that the reality is I don't always apply DEET to my kids or DEET to myself. We'll wear protective clothing and we do tick checks. So if you get a tick off typically within 24 hours, the risk of getting Lyme disease really goes down substantially. So I don't necessarily always send my kids out with DEET 24/7, but if they are going to be, if we're hiking and I know that we're really going to have a lot of exposure, then I will put a DEET-based bug spray on them. And I do prefer to keep the bug spray and the sun screens or sunblocks separate. It's really not recommended to, because there are products that combine them, and you're going to hopefully be reapplying your sunscreen or sunblock more frequently than you're going to need to reapply your bug spray.
So, let's go back to the sun a little bit. There's a lot of we were discussing this before the show. Waterproof this and waterproof that, and last 8 hours and last 12 hours. And that could be a hunky-dory. But in reality, if you get into water, after you've just applied sunblock or sunscreen, what happens?
So it goes away. So common sense kicks in. So it's the FDA had, when we were growing up, the sunscreen bottles would say waterproof and sweat-proof and things like that. And the FDA has now said that people cannot label that way.
Okay.
When you pick up a bottle of sunscreen, you're going to see the SPF, which tells you about UVB and sunburn protection.
Like we discussed. Yeah.
You're going to see something that says water resistance, and then a number, and then minutes.
I see.
So the FDA a few years ago actually finally tested sunscreens to see how long they're resistant in water. And the best sunscreen lasted 80 minutes in water.
Okay.
So that means that if you were in the water for, more than an hour or so, your sunscreen's really not effective anymore. Okay. So you have to come out and towel dry and reapply your sunscreen. The other thing is, if you get out of the water and then you're toweling off, you're actually probably also losing a lot of your sun protection. Yeah. So there's, I tell my patients, look at the number on your sunscreen, because some of them are less, some of them are 40 minutes. So know what your sunscreen says, know what it does, and be mindful of it. But you do have to reapply more frequently if you are sweating a lot or if you're in the water.
And that's a big misconception we always hear, it says 8 hours. Why do I need to apply?
Yes. Well, it shouldn't say 8 hours anymore.
Of course, yes.
And that's another point, which is if you have one that says that, it's probably expired.
Get a new
and you
one.
should check your sunscreens for their expiration date, because that matters.
Okay, cool. Thank you so much. How frequently should a patient or someone see a dermatologist?
That really depends upon the patient.
Sure.
What we know for a fact, or what are general recommendations, is that an individual who's had a skin cancer should have a skin check at least annually.
Okay.
An individual who has a first-degree relative who's had melanoma should have a skin check by a dermatologist annually. I would even suggest, and the Society for Pediatric Dermatology supports, for young children with a second-degree relative of melanoma, they should also probably be checked annually by a dermatologist, and that's because there is some genetic risk more related to melanoma than other types of skin cancers like basal cell and squamous cell. So my general recommendation for kids, if they have a parent or grandparent that's had melanoma, is that beginning around the age of 10, they should have their first baseline skin check. I certainly see kids younger than that. If the pediatrician notices an abnormal mole or has concerns about the number of moles, I may see them sooner. But in general, melanoma prior to puberty is very, very rare. Okay. And so I recommend 10 just as a general age. Okay. I've seen melanoma in kids, I've cared for kids as young as 17 for melanoma.
Really?
Yeah, so it is something that you don't think about as a teen. So if I'm seeing patients who don't have those risk factors, and a lot of times seeing their parent, they say, when should my kid come in for a skin check? I usually say, have them come in sometime while they're in high school, get a baseline skin exam. I can teach them about good sun protection. I can teach them about the dangers of tanning beds and how to, and the importance of avoiding tanning beds. Okay. And I can teach them about what to look for, so that once they go to college, they have a good baseline. And I can kind of give them a general idea of what they need as far as monitoring for their moles.
You hit on something that's not on my agenda today, but I want to hit on it.
It's always on mine.
The tanning beds.
Tanning beds.
Let's spend a couple of minutes discussing that.
So they're not well regulated. They have a really good lobby. Very, very proud to say that I think 3 years ago, the state of Massachusetts did pass some really good legislation so that minors under the age of 18 have to have parental consent for tanning bed use, which 4 years ago wasn't required.
Nice.
The World Health Organization actually lists tanning beds as a known carcinogen. That means cancer-causing instrument.
Yep.
And so we're talking that it's basically being put on the level of cigarette smoking. Okay. And never mind the photoaging and the increased skin cancer risk. They're also kind of mini petri dishes. I mean, they're not very clean.
Gotcha.
I think that the use of tanning beds in teens has decreased dramatically since I was a kid.
Okay.
But there still are people using tanning beds, and I don't think it's good for my patients when they're adults, but I'm very glad that teens at least have to have the consent of an adult to use it at this point.
The thing got to the legislators that
Yes,
passed
yes,
that law.
yes,
So
yes.
to protect our teens from.
It's very important, and
Awesome.
there's been a lot of other states that have done that, but it is not universal at all.
Thank you for touching on that subject. Let's go back to the sun again.
Okay.
But there's a lot of clothing out there that's being
Yes.
sold as UV this and
Yes.
UV protection this, and hats and pants and shoes. What do you think?
So when I talk to my patients about sun protection,
Yes.
the last thing we talk about is sunscreen.
Okay.
So what I tell people is, the first thing that you can do is to do your best to avoid the strongest sunlight, which is generally between the hours of 10 a.m. and 2 p.m.
Okay.
So choosing activities on the opposite ends of those is ideal. My family, we tend to go to the beach in the afternoon.
Okay.
It's great. Most people are leaving. You get the beach to yourself.
Yeah.
The shade is your friend. So if you have the choice to sit under the blazing hot sun or find a nice shady spot, finding a shady spot, you're going to find protection. Hats,
Okay.
especially wide-brimmed hats. So a baseball cap is going to protect the top of your head.
Yeah.
It's going to protect a small area of your forehead and nose, but that's about it.
Okay.
So don't think just because you have a baseball cap on that you're getting great sun protection. You're getting a little bit.
Yeah.
But wide-brimmed hats definitely are the best. And then the sun protective clothing, they can be expensive. It doesn't have to be UPF clothing. So sunscreen and sunblock has SPF.
Yeah.
Sun protective clothing have UPF.
UPF. Okay.
And I like the UPF clothing for swimming especially.
Okay.
But if you take a piece of clothing and you hold it up to the light, if you can see through it, there's sunlight getting through.
Okay.
And so a white, thinly woven shirt, you're going to be getting sun through that. A darker, more tightly woven shirt, you aren't. So you're going to get good sun protection from a dark, tightly woven shirt. It may not be comfortable to swim in. So in my family, we have sun protective shirts that we wear and continue to wear that either is short sleeve or many of them are long sleeve.
Yeah.
And especially if we're going to be out in the kind of sunniest parts of the day, we always have those on.
And those are materials that are cool. I mean, it's not like they get hot in them.
No, there's a misconception about
Correct.
this.
Yeah.
Everyone, thinks that it's going to feel so hot, and they're actually really quite comfortable. And when you don't have to worry about covering your body, an extra part of your body with sunscreen, you are more likely to have better sun protection. And so, when we go, on vacation or in the Caribbean, it's a lot easier because we have to protect our legs.
Yeah.
And for small children, it's so important because also, especially think about sunscreen and sunblock are not necessarily recommended for children under the age of 6 months.
6 months. Okay.
So, and that again has to do with the rate of absorption through their skin.
Absolutely.
So in general, those children should be covered. Okay. They should be in the shade. They should not be out in, direct sunlight.
Okay.
But if you have a small area that you have to cover, the chance that there's going to be a real problem from that goes way down. Busy parents, multiple children, trying to chase around 2 or 3 kids to reapply their sunscreen every 2 to 3 hours or every hour if they're in the water. That can be really difficult. And I think that by wearing sun protective clothing, especially for outdoor activities or swimming related activities, it's really, really beneficial.
And also I think it's also important that that stuff that even you apply on the skin, whether it's sunscreen or sunblock or bug spray. Please shower, take it off right when you get home. You don't want that stuff, you know.
And you bring up a really good point, Sid, because the FDA up to this point maybe hasn't done the best job at testing sunscreens and sunscreen ingredients. And there are 16 sunscreen ingredients right now that are generally regarded as safe and effective. Okay. 2 of them are the titanium dioxide and zinc oxide, which there's a new proposal to suggest that those should be the only 2 that are generally regarded as safe and effective. 2 were taken, the proposal is to take them off that list. That's PABA and I think it's toluene, salicylate. And there's another 12 that the FDA is looking at and saying, you know what, these actually really need more testing, because in the 1970s, when sunscreen was approved for the first time, people were applying a little bit here and there. And now, as we have more recreational activity, we spend more time outside, our ozone isn't working as well as it used to, the rate of skin cancers is on the rise, people are much more serious about applying it to large body surface areas. And an article just came out, the FDA just found maybe 3 weeks ago, they were able to measure 3 specific chemical sunscreens in the bloodstream of people who had applied it to their skin. So there's avobenzone, oxybenzone, and octocrylene. We don't necessarily know what that means yet, but there have been groups like the Environmental Working Group that have suggested looking at studies where animal models have been exposed to large amounts of those chemicals, that there may be some impact on that animal model. I think a lot needs to be done and studied, and I wouldn't necessarily throw all your sunscreen away, but we do need to look at these things. So yes, the less body surface area you need to apply these sunscreens to, I would say, the better. But I'd rather put on a sunscreen than run the risk of skin cancer down the road.
Thank you so much. So, how could somebody at home do self-evaluation, skin self-evaluation for skin cancer or any type of skin damage?
Sure.
Whether they can't get to a dermatologist or in between dermatology visits, what can they do at home to ensure that their skin is still in good shape?
So if you don't live alone, get your partner to help you.
Okay.
So look together. If you do live alone or you don't trust your partner to look well, then you're going to need a couple mirrors. Okay. So you're going to need one stable mirror and one handheld mirror. Okay. And you can't see your scalp, but you can see almost everything else. Okay. And just by you can see your back by holding a handheld mirror and looking at the reflection from the other mirror. You can see underneath your legs in the same way. There's a really good kind of images on the American Academy of Dermatology website that you can refer to, which will show you how to do it. But you just need a couple of mirrors and 5 minutes.
And I think it's important that we do it all the time, because the sun, as you said, the ozone layer is not as protective as it used to be. Our sun is much stronger. Yes. And we just need to be cognizant of the fact that skin cancer is on the rise. Yeah. And has been for a long time, and we just need to do all what we can to protect ourselves and our children especially. To protect, skin is the biggest organ in the body, and we need to protect it the best way possible. So, anything else you'd like to add, Dr. Burnett?
Only one thing.
Please.
Which is the question of whether it has to be sunny to get a sunburn.
Great question.
And
thank you.
Because you can actually find with, everybody has a cell phone, there are apps that you can look at the UV index every single day that will tell you how high the UV index is. And it does not have to be a sunny, gorgeous day like today to have a high UV index. In fact, a lot of really cloudy days have a high UV index because the UV radiation gets to the Earth's surface and then doesn't have the same ability to get out. Okay. And so that's the only thing really I think that we didn't touch on that you need to be mindful, not just on hot sunny days, but also in areas of higher elevation, when you're on the water, because sunlight will reflect off of the water. And all of these things kind of need to come into play when you're thinking about really protecting your skin.
And how about when driving? You know, I see a lot of people wearing gloves on the steering wheel and stuff, especially during the summertime.
Yes.
What's your opinion on those things?
So I think if they really don't want their hands to photo age, that it's a great idea.
Okay.
And because what's happening is UVA penetrates glass.
Okay.
So UVA, which is the UV radiation that leads to brown spots and wrinkling and accelerated collagen degeneration, that is going, and if you spend a lot of time in your car, you're going to be getting a lot of that.
Okay.
Yeah.
Thank you so much.
Oh, thank you so much.
This was a great discussion. We appreciate it. We appreciate your time and effort and your great expertise.
Oh, thank you so much for having me.
We appreciate it. Dr. Burnett, thank you again for taking the time to join us on our show today and sharing your expertise. As I said, you have provided some very, very useful information on how to enjoy the sun while being safe out there. Thank you all for tuning in to A Healthier You. I'm Saad Dino, co-owner of Acton Pharmacy, Keys Drug and West Concord Pharmacy, and I look forward to seeing you around town. Be well.